Epiblepharon is a common developmental eyelid anomaly that often involves the lower eyelids bilaterally. It is a condition wherein a horizontal fold of skin and orbicularis overrides the eyelid margin, causing the cilia to assume a vertical position. This overriding of the anterior lamella over the posterior lamella causes the lashes to brush against the ocular surface. The most common type is the developmental, congenital, or primary epiblepharon, typically seen in children or young adults of East Asian origin, although not restricted to this ethnicity. Several theories proposed for the etiological factors leading to epiblepharon are congenital mild development of the lower eyelid retractors, failure of lower eyelid retractors to gain access to the skin, and failure of interdigitation of septae in the subcutaneous plane, hypoplastic or aplastic tarsus, hypertrophy of the orbicularis muscle, excessive cheek fat, and genetic or racial predilection. The classification for epiblepharon proposed by Kwok and Lee grades 3 morphological characteristics that may determine the severity of epiblepharon: the horizontal fold of skin, cilia touching the cornea, and keratopathy. Severity of skin fold is classified according to the height and degree to which it conceals the lower lid margin. Class 0, wherein there is presence of excess skin without any overriding. Class 1, presence of overriding of the skin but not obscuring the lash line. Class 2, presence of overriding and concealment of the medial 1/3 of lid margin. And Class 3, wherein concealment of more than medial 1/3 of the eyelid margin is seen. The resulting ciliocorneal touch is classified as Class 0, no lash touching the ocular surface; Class 1, lashes touching the ocular surface medial to the medial limbus; Class 2, lashes touching the cornea till center of the pupil; and Class 3, wherein lashes touch the cornea beyond the center of the pupil. The severity of the resulting keratopathy is classified as Grade 0, wherein no corneal erosion is seen; Grade 1, involvement of the inferomedial cornea; Grade 2, involvement of the inferomedial and inferotemporal cornea; Grade 3, involvement of central cornea beyond the pupil; Grade 4, involvement of 2/3 of the cornea; and Grade 5, wherein corneal ulceration is present. Symptoms of epiblepharon include irritation, itching, discomfort of the eye, rubbing of the eyes, and tearing. Clinically, it is also important to note that eyelid margin is in a normal position as opposed to entropion, in which eyelid margin is inturned. Persisting symptoms and development of keratopathy are the main indications for surgery. Herein, we describe a case of a 4-year-old boy with bilateral symptomatic lower lid epiblepharon surgically treated with modified Holt's procedure. The amount of planned excision is marked by pinching the excess tissue, preferably with a tooth forceps. A spindle-shaped excision of skin and orbicularis is done. Lower lid retractor edge is identified. The sutures are passed from the edge of the lower lid retractors, coming out acutely by ledging the tarsus. The suture is tied to assess the correction. The end point of correction is eversion of lashes. Rest of the sutures are applied along the length of the eyelid. The skin is closed by continuous sutures. The procedure was repeated on the other eye. Child did very well after the surgery. An objective system to grade is highly useful to decide on plan of management and compare results post-operatively. Surgical options are many, but a simple, modified Holt's procedure has proven to have a good success rate for optimal management of these children.